As Black History Month comes to an end, we want to talk about a really special topic that we've been trying to shine a light on recently, and that's mental health and the Black community. So we have licensed psychotherapist CHIMERE Holmes joining us now, explaining where some of these issues lie historically and how we move forward. What we do know, CHIMERE, is that this is a huge problem, and right now it's not getting better.
Absolutely, absolutely. Thank you so much for having me, Hattie. It's a pleasure to be with you today. Unfortunately, there is a tremendous amount of stigma that remains within the Black community. Mental health is something that has never essentially been normalized in the Black community. And there's just a lot of uncertainty, right? A lot of gray area. And folks are just not reaching out for help as they essentially should and owe it to themselves to do. Some statistics state that 1 in 3 Black adults who desperately need mental health services will not actually speak up or reach out to get the services they need. Part of the stigmatization around mental health is that 63% of African-American adult men and women believe that if you have a mental health disorder, you more than likely have some sort of personal weakness. So there are some misconceptions, some untruths, some fear, undoubtedly, some mistrust of the healthcare system. And then it also boils down to finances. If there's financial insecurities and a lack of adequate health insurance, that can serve as another tremendous barrier as to why folks aren't reaching out or they're not quick to look for consultation when it comes to serious mental illness.
And, you know, some people, they confuse the source of a problem with the actual symptom. So what kinds of things are people experiencing and seeing, and what is actually the likely thing that's going on here, the mental health issue that's actually happening?
Absolutely. So African Americans arguably have even greater stressors than some of their white or non-Black counterparts. Folks deal with things like depression, anxiety, stress disorders, marital issues, parenting stress, especially since we've all been quarantined at home like this for about a year now. And so these abnormalities, they equate with, well, it's probably just I'm having a difficult time or I'm having a difficult go with it. I have to push through. And that's something that traditionally a lot of the African community is accustomed to. It's like you kind of have to suck it up and keep moving forward. But essentially, these issues that they're facing or trying to sweep under the rug are very symptomatic of a larger problem, which could be one or more diagnoses. And they need a mental health professional, sometimes even medication, to help alleviate a lot of those feelings.
So how do we move forward, and what is the beauty when you actually can move forward? What are those changes you're going to see when you start to acknowledge that, yeah, I could use some help?
Absolutely. I think that there's freedom and there's just a tremendous amount of liberation in insight and awareness. I like to tell all of the clients I work with, those are essentially the first 2 steps to healing. Just being able to vocalize, I don't feel okay, or everything that's going on at work and everything that's going on at home and this pandemic and society with racism, I don't feel okay. So being able to vocalize it, to write it down, can be incredibly freeing for an individual. When you do reach out for psychotherapy, professional mental health counseling, you're more apt to live a healthier and a fuller life. You can start working on symptoms. You can adapt a plethora of different coping techniques, coping strategies to help you not so much cure depression, because some people might just be naturally dysphoric or have generalized anxiety disorder, but you can cope and you can definitely function better at work and at school, within your family.
Finding help is a strength, not a weakness. I appreciate all your insight and everything that's going on. If anyone wants more information, where should they go to find you?
Sure. I would be happy to talk or consult with anyone, and you can check out my website, which is www.chimereholmes.com.
All right, CHIMERE, thank you so much.
Thank you, Hattie. Thanks for having me.